This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222. And are you seeing patients who've failed a cycle and wanting to know why, and seeking, well, there's that bit, which is probably a medical question, but they often can't get in to see their doctor quickly. Yeah. And secondly, the emotional fall that occurs after building up all this hope to then have it dashed by a negative pregnancy test.
Yeah, look, in terms, I would always practice obviously within my nursing scope as well, and only answer questions that I think are suitable. Anything obviously medical related, I would redirect back to their fertility specialist. I have had a few teleconsults with some patients about perhaps, what quite an often question is, at what point would you engage or would you consider having potentially a second opinion as well? So I think obviously that's up to the discretion of the patient and what they feel comfortable with. I think you have raised a really good point about sort of generally 9 times out of 10 when I've worked in a clinic and perhaps a patient has had a negative pregnancy blood test result, we would often send a counselling order. And sometimes, with the higher clinic, with obviously such a large kind of patient group as well, sometimes that counselling call might not necessarily get to them within a particular time frame. There may be some slight delays potentially. And I think this is where that service, I have the time to sit with patients to genuinely listen to their concerns. And if they needed someone to physically sit there, come into their home and support them, give them the time and the reassurance as well. And I think it's also a good opportunity to really listen to their concerns. A lot of times, and I'm sure you've got this in patient consults as well, what could I have done, or what could we do differently next time round, rather than repeating the same treatment protocol and the same medication dosages as well.
Yes, so certainly, I find that as an issue. When I do a lot of second opinions, and it does disturb me that in some clinics where the treating doctor is not the CREI, not the well-trained fertility specialist, but rather just a generalist, and they often just go this, let's try the same thing again. A detailed look at actually what happened in that cycle, the dosages of the drugs, the type of drugs, the numbers of eggs that were collected, what happened in terms of fertilisation, and look forward to providing variation, which will result in a better result. I spend a lot of my life doing that sort of stuff. It's and for patients, they do get frustrated with just being told the same old.
Absolutely. That's often a common question. Well, why would we repeat the same process if we knew that we weren't successful the first time round? And to be honest, if I was, sitting in the patient seat as well, I would be asking the same questions and educating them on potentially maybe we could consider this different treatment approach, or these are questions that would be best raised with your specialist as well. It's sort of giving them a bit of those resources to have on board for that next consult when they're coming up with their next sort of treatment plan as well.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.